presentation from the county's healthcare assistance program. And again, we will have Kinder Morgan here in 2 weeks, so we will continue to follow up on this issue. Thank you very much for all those who presented. Ms. Michael?
Good morning, Jamie Michael, County Health and Human Services Department. I'm here today to provide a report to the board on the county's healthcare assistance program. This is one of the programs that is mandated for county government. It is governed by the Indigent Hospital and County Healthcare Act. The packet that you have has a copy of an annual report that our department produces, and it also has the resolution that was passed by the board that governs the operations of this program. To begin with, I have just a little bit of information about the Act so I can set some framework for everyone. Counties are responsible for providing ambulance transportation, for hospital care, for other types of delivery of healthcare services. They're responsible to provide revenue to help support the state's Medicaid program, and then in general improving the provision of health care to people who qualify for the county's indigent program. Some definitions inside this act include the definition of healthcare services. So this includes the treatment and services for people in our county, everything from primary care to detox services to preventative care. And it is defined by the county commission through the resolution and the contracts for service that you all put in place. There's also, it's important to understand the definition of someone who qualifies for indigent. It's a person who can normally support themselves. So they have some type of income, but because of a health care need, they're unable to pay for those services. So that's, sometimes it's kind of an awkward definition because we often look to provide assistance to people who have no resources, but this really is for the category kind of commonly known as the working poor. There is a resolution that was attached to your packet that defines the criteria that our county uses to enroll someone into the program, so it defines their eligibility. This act also gives the counties the power to budget for ambulance services, the burial expenses, hospital or other medical services that people who qualify for the program may incur. We can also use some of the money to help with some of the regional planning, either county or multi-county wide. We also can accept public funds. We have in the past, we currently do not. And we can also hire people to help carry out the work required by this act. There are a couple things that we must do, we shall do. We shall transfer funds each quarter to support the state safety net care pool. We also have to comply with any HIPAA rules. We have to provide money to support the Medicaid fund at the state level in addition, and then we can contract with providers to provide the health services that are required in our county. So the state mandates, which are really the most important for you to understand because they can skew what our department budget looks like. The county has to support the state Medicaid program. So there is an increment of the gross receipts tax that comes in and is immediately, it's just a pass-through, it's immediately sent to the state. And that totals about $2.4 million each year. In addition to that, the quarterly payments that we have to make to the safety net care pool come out of the indigent gross receipts tax, and that totals about, this year it's about $2.9 million. So in total each year we're sending up over $5 million to the state to support the state's Medicaid program. The resolution that was passed in 2018, it talks about the requirements that someone needs in order to qualify and become enrolled in the program. Obviously, we need some form of identification so we know who the person is. We need to know their total household income because they can't exceed a certain income. We also need proof of current income because it's defined as someone who can normally support themselves. And we need to show that they reside in our county. So these are the primary criteria that we look for when enrolling someone into the program. The contracts or the types of services that are provided through contracts include primary care, dental care, behavioral health, end of life, some physical therapy, and then our ambulance services. So this graph shows spending for the healthcare assistance program over the 3 prior fiscal years. For FY19, we look like we're going to be on track to be right around somewhere between the 2.5 and the 3 million. So nothing out of the ordinary that we're expecting in the coming year. This shows the total number of patient encounters by contracted provider. Ben Archer Health Center provides by far the most number of encounters. Their contract is the largest contract we have under this program, but we also have a contract with La Clinica de Familia, Mesilla Valley Hospital, Mesilla Valley Hospice, Mesilla Valley Hospital, St. Luke's, which is now known as Amador, and then Southwest Sport and Spine Center for the physical therapy services. This is total number of patient encounters by type. So you can see here we provide services for dental more than any other type of service. This was a huge shift after Medicaid expansion. Prior to Medicaid expansion, the largest number of service encounters were for primary care, but because more people are covered with Medicaid expansion, the indigent program is having to cover fewer people. The reason dental is such a large number is because people who are on Medicare may not have dental coverage. So that population needs to access dental services. La Clinica and Ben Archer are both dental providers, and they see people who are covered by Medicare but do not have the dental coverage. They still qualify financially for the program, and since they don't have that as a covered service with their Medicare program, we cover that through our contracts. And then we have primary care integrated services, someone who is seeing a primary care provider but also addressing behavioral health issues, behavioral health only. Room and board is within Mesilla Valley Hospice. They do outpatient or home hospice services, but they also have room and board that they provide within their facility, which is also not covered by Medicare or Medicaid. And then a little bit of physical therapy and a little bit of inpatient substance abuse treatment. We also do hospital-based services. In our county, we have 2 hospitals, Memorial Medical Center. We do not pay a claim to Memorial Medical Center based on an encounter because of the lease agreement we have with them. They cover people who qualify for the indigent program, and they also have a charity care program. Mountain View Regional Medical Center receives money from the state. That safety net care pool that I talked about, all the counties send money to that, and then the state sends it back to different hospitals based on their uncompensated care. So that hospital gets some of those funds. We also have residents that qualify for a program that sometimes go out of county. If a hospital here is not able to provide that medically necessary care, they may end up in a different hospital. And we pay a few out-of-county claims each year, and we pay them at a very low rate. I don't know how this rate came to be, but it's a great rate, so I'm not going to try to go back and renegotiate anything better, because 36% of the Medicaid rate is a really good deal. We also have folks that have to go to UNM. They have a lot of specialists at that facility. So if someone goes to UNM Hospital is also provided state funding through the state's uncompensated care funds. This shows the blue bar is the number of encounters. So each year you can see how many encounters. That includes primary care, dental, includes all of them. Then the number of people. So the green bar is the number of people that are enrolled into the program each year. And the bar that you can barely see down there is the number of hospital claims. So very few hospital claims. Again, after the Medicaid expansion, we are not having to pay these out-of-county hospital claims. For FY19, it looks like our hospital claims may be closer to 8 or 10 claims versus 4, but it's still a drop in the bucket compared to what it was previously. The system that we're using to enroll people is called the Indigent Health Solutions. It is a web-based system, so if you go to Ben Archer and you get enrolled, you can be seen at La Clinica or Mesilla Valley Hospital, and it's all online. You don't have to re-enroll at each of the centers. So it's done once each year, and we have 46 people throughout the county that are users that can enroll people into the system, and those are spread across 7 different organizations. You can see here that the type of service people enroll in, the majority of the people are enrolling for dental coverage only. So again, that's our Medicare population that does not have dental coverage. Then we have people that enroll in full coverage because they don't have any other type of insurance, and so they need coverage for all service types. We have a few people that after the enrollment, we find that they're not eligible, so they're denied services. We have some people that are hospice only, and then a very few people that are behavioral health only. This was one of the concerning data points, and that's why we asked the board last year to update the resolution, because we felt that maybe some of the criteria for enrolling in the program were barriers to people who might be experiencing a behavioral health crisis. So we're going to be paying attention to this data over the next year or two and hopefully see those numbers go up or find out why there's not a lot of folks accessing behavioral health services, because we know that if 1 in 5 of us are suffering from a mental illness, that there's a need to access services. The other area that the Healthcare Assistance Program covers, other than direct patient care, counties are responsible for any unclaimed bodies. So each year we work with the Office of Medical Investigator, the local hospitals or other organizations, and we accept the bodies, we pay for the cremation, and then we have an annual burial service. We're required to keep the bodies for 2 years in case a family or friend comes to claim the bodies, and if that doesn't happen, then our staff put together a very respectful burial service for the people who have passed. And you can see the numbers over the last 3 fiscal years. Again, we don't see any big change. We're not predicting any big change for the current fiscal year.
Jamie?
Yes, sir.
Where are these bodies kept?
They're kept upstairs in our department in a locked cabinet after they're cremated.
I was going to ask for that clarification. Like, I will no longer be coming after hours to the building. Yes.
Yes, sir.
In regard to the people sent to UNM, that's in Albuquerque, right?
Correct.
What if they don't have means of transportation? Do you guys have means of transportation for them? Or
Commissioner Gonzalez, Madam Chair, currently the Healthcare Assistance Program does not provide transportation other than emergency transportation or if an interagency facility. So if one hospital asks for the interagency facility, then AMR would provide that. But if I'm going up, able to go up in my personal vehicle, there is no transportation that we provide for that.
Thank you.
Oh, yes, sir.
Where are the bodies scheduled for burials kept?
So once someone passes, they go to Bacchus Funeral Home. Bacchus Funeral Home provides all of the cremation services, and then once the bodies are cremated, they come to our department, and we record them and store them for 2 years. And then every year, the bodies that are ready for burial, I think it's St. Joseph's Cemetery here in town where we have the burial service.
So the bodies are all cremated?
The bodies are all cremated.
Madam Chair?
Sorry, did that not answer your
Bury
question?
the cremated remains.
The cremated remains are here in our department.
You bury them.
And then eventually we bury them. We have to hold them for 2 years, and then we bury them.
And when do those records go? Where do those records go after that? Or you just keep them for life, or what? Or they're being...
There is a required length of time, but we've kept them since the beginning of our department because we have had people that call and say, I'm looking for my brother, I'm looking for for someone. And so we have records all the way back to the beginning of our department.
Thank you.
And then lastly, through the funding that our department oversees, we also cover the ambulance service. AMR Inc. is the ambulance provider. Here, just the number of calls, it looks visually can be deceiving there, but really there's not a big difference in the number of calls for FY17 and FY18. And again, FY19 doesn't look that different. We monitor this contract in conjunction with the Fire Marshal's office. And that is the presentation I have. If you all would like more information on the program, I'm happy to get into more detail, and I stand for questions.
Commissioner Reynolds?
Madam Chair, Commissioners, Jamie Michaels, could you go back? There's a couple slides I'd like to go back, and I have one quick question. On the one where you show the services for the incident care.
This slide?
Yeah, that'll work. You're showing here that the services provided are primary care, integrated services, dental services, behavior, all listed here. There's two cares that I'm curious about that I wonder if we cover. One is eye care, and the other one is medication. Where do those fall in this chart?
Madam Chair, Commissioner Reynolds, currently the indigent or the healthcare assistance program does not cover those two services. We have tried in the past to do some of the eye care, especially for people that have diabetes, and we've been unsuccessful in finding a provider in the community that was interested in entering into a contract with us. And the medication, right now we rely on all three of the federally qualified health centers because they have prescription programs that are supplemented by the federal government. So they have prescriptions available at very discounted prices. We also work with an organization called Coast to Coast, and they provide discounts for prescriptions, but we don't use county dollars at this point through this program to buy the prescriptions for people.
Thank you. I think it answered my question.
Any other questions?
Madam Chair.
Yes, Commissioner Owens?
Amy, the contract with the hospice, is that to fund the room and board aspect?
Commissioner Ellens, we have a contract with hospice to do both. The room and board is one of their priorities because no other Medicare and Medicaid don't cover that, but we do both fund the room and board or the home-based hospice services.
Do you know what other funds they receive and from what other organizations?
I do not. We get an annual report from each of the providers, so I can look in their annual fiscal audit report, and if that information is in there, I can get that for you.
Thank you. And thank you for all of the work that you do. I mean, it definitely serves a segment of the population that falls in that in-between. So thank you very much. The next item on our agenda is